uh, Elizabeth, and thank you guys for allowing us to come and to present to you today. We just want to give you a brief overview about what we're doing as it relates to food security and go over the SDOH strategies. Probably did someone say something? I'm sorry. Oh, okay. And hopefully that you see that there's room for us to connect or collaborate by the end of the presentation. And I'll turn it over to Elizabeth to introduce herself.
Hi, good afternoon. I'm Elizabeth Hardig, and I'm here, just as Tracy said, to support the work around food security. Excited to hear what you all are up to and share a little bit about what we've been thinking about and talking about and planning for next year.
Tawana, did you want to introduce yourself?
I can. Good afternoon, everyone. My name is Tawana Hatcher. I'm the Senior Health Programs Advisor on the Policy and Planning team. I work with, my projects include the SDOH Hubs pilot with Elizabeth, as well as the Rural Health Equity Plan, the Racial Health Equity Plan, and the local health department planning grant that just completed in the end of September. Thank you all for allowing us to present today.
Okay, so we will just jump right into it. Did you want to jump right into it, Danielle?
Yeah, that's totally fine.
Oh, okay, thank you.
Yeah.
We're gonna do a brief review about the social determinants of health and the SDOH strategies. We're gonna discuss the proposed food security focus area, and we're gonna do questions and answers, and then we're gonna wrap up and talk about next steps. Okay, first, right here, I'm going to talk a little bit about what is social determinants of health, because this is the foundation of our work. As you see, social determinants of health is where people are born, grow, live, work, and age that shape health. We have broken it up into 4 buckets: economic stability, neighborhood and built environment, social and community context, and education access to quality. When we think about economic stability, we factor in things like income, employment, access to nutritious food, safe housing, healthcare service, all of these things that plays an important part of individuals being able to live a healthy and stable life. Mm-hmm. Social and community context, you think about people being exposed to crime and violence. That impacts your mental and physical health. So that shapes your environment that you grew up in. So that has a lot to do with social determinants of health. And we all know someone who's been there or ourselves been in them situations. Neighborhood and built environment. When we talk about neighborhood and built environment, I'm thinking of clean air, green space, public transportation, which we know public transportation can always be a problem in urban communities and in rural communities. So we know that affects our physical health and our lifestyle choices, because when we don't have transportation, it's hard to get to the doctor's office. It's hard to get to the grocery stores, to be able to buy food and different products. So transportation is very important when you think about the environment. Having access to quality education, which is very important, because that influences our health outcomes. You might not think it does, but it do, because without a quality education, it affects our judgment, shaping our knowledge, decision making, and being able to have access to jobs, quality jobs. So all that plays a big part of social determinants of health. And so the next slide, we're just going to play a brief video for you, and it will give you more of a visual about the social determinants of health and why we do the work that we do.
We all want to be healthy. We know that health is influenced by who we are and by what we do. However, the conditions in which we are born, grow, live, work, and age have a greater impact on our health. These conditions are called the social determinants of health and include things like access to a healthy home, nutritious food, quality education, and job opportunities. To ensure everyone can live their healthiest life, we must work together to address social determinants of health and improve community conditions, especially for communities who are more affected than others. The Michigan Department of Health and Human Services is a leader in creating opportunities for everyone to be healthy, with many programs and resources that address the social determinants of health. For a greater impact in communities, we're working with partners across the state to implement a social determinants of health strategy called Michigan's Roadmap to Healthy Communities. The roadmap provides a framework to improve upon the work we are doing, align resources and efforts for a greater impact, and promote innovative ideas to improve health and well-being for all. Through Michigan's Roadmap to Healthy Communities, we're working to remove barriers to access life-enhancing resources, support communities that are disproportionately burdened, and promote policies that advance equity and opportunity and ensure everyone reaches their full health potential. To learn more about the social determinants of health strategy and ways to get involved, please visit our website.
Okay, I hope that video shed more of a light about what is the social determinants of health. Okay, right now I'm just going to jump right into our SDOH strategies and phases. I'm just going to give you a brief background on phase 1 and phase 2 and how we coming upon phase 3. Phase 1 of the SDOH strategy, we took a deeper in-depth look internally on our current initiatives, internal policies and programs, and reprioritized the efforts and broken them up into 3 focus areas: health equity, housing stability, and food security. These improvements are currently being assessed and monitored to ensure measurable benefits. And then we moved on to phase 2. Phase 2 is a continuation from phase 1. We're promoting improvement and alignment, making space for innovative initiatives, cross-cutting policies to address upstream prevention. Phase 2 will also build on the alignment efforts from phase 1, taking a more holistic approach, focusing on health equity through collaboration. Phase 2 also identified 4 structural areas. CIE, which is the Community Information Exchange, the CHW, the Community Health Worker, the SDOH Accelerated Plan, which mitigates chronic disease, and Health Equity Partnership. And then now we're going into phase 3. It's all is a continuation. So we haven't forgotten about phase 1 and 2. We're growing and we're just adding and enhancing what we already done in phase 1 and phase 2. Phase 3, innovation. We started the SDOH hubs. Elizabeth will be able to talk more about the hubs. We're taking a health and all policy approach in phase 3. And in the next slide, I'll be able to talk more about phase 3. Elizabeth, the next slide. Okay, now we're currently in phase 3. In phase 3, what we did was we established a food security alignment work group. That encompasses partners from which in MDHHS that's currently doing the work around food security. So far we have had a few meetings, and during the June and August meeting with the work group, we took a deeper dive into the existing program and strategies. We wanted to gain a deeper understanding of the strengths and the weaknesses to identify opportunities for improvement and pinpoint any existing gaps in the system as it relates to food security. This analysis will serve as a foundation for informed decision-making, enable us to refine our approach, allocate resources efficiently, and develop a target intervention that can serve better to the needs of the community. Ultimately, our goal is to create a food security system that ensures access to nutritious food for all. This analysis is very important as a step towards achieving that objective. And then right now, currently, we're in the stage where we're identifying our priority strategies. We have 4 focus areas, which Elizabeth will address in detail: addressing environmental health factor, improving food access, supporting agriculture development, and reducing disparities. So we meet with our partners monthly, and they're helping us to identify initiatives that will fall up under one of them buckets and where we should be focusing our attention on going into phase 3. We know that leveraging innovative technology plays an important role in transforming our food system to be more inclusive. By addressing these dimensions collectively, we work towards a more equitable and sustainable food landscape where everybody have access to nutrition food and food disparity are significantly reduced. And hopefully by November, we will be finalizing all our content. This is when we will develop a work plan for phase 3 that will successfully implement our initiatives. Our partnership, which will play a very important role in establishing our goals so we can leverage collectively how to address the food security comprehensively. These metrics should serve as a benchmark for progress and evaluation. So we will be monitoring these strategies going forth. We have met with several partners. We have identified quite a few strategies and recommendations that we are looking at right now. We're in the process of narrowing them strategies and those initiatives down so we can choose just a small amount to focus on to move the food security work forward in phase 3, which would take place in January. So the work plan would just act as a roadmap, just so we can see to make sure that we have measurable goals and outcomes and make sure it's meeting our expectations for phase 3. Do we have any questions so far?
I don't see anything in the chat, but feel free, anyone, to unmute or ask a question. We definitely want this to be a conversation.
This is Joyce Seals from Saginaw, Michigan, working with the Saginaw County Health Department and the HEC coordinator for Saginaw. And my question is this: in our community, we have no inner city grocery stores at all. And we had one bus stop at one of our main, in fact, it was Kroger store, who decided they didn't want a covered bus stop there. So anyway, we're working with one organization called the Food Club. So we're trying to develop something that's unique. Do you guys have any strategies or opportunities there at your table to assist our group who is trying to get off their feet to get this food club started?
I don't have an answer to that offhand, but I would definitely take that back. And if I can get your contact information, I can definitely talk to you offline regarding that.
Yeah, Tracy, I would love to do that because our person is working right now. She's raised about $4.5 million. She's got a little bit more to go. And so she's trying to get this project started, which will work on points systems for people for shop or healthy foods, kind of copying something from the west side of the state. To me, she's still trying to iron out a few bugs. But if you guys have any recommendations, some support, some other knowledge or something that you can give toward that, I'm sure that our person is going to really appreciate some of that knowledge.
Mhm.
Okay, definitely, Joyce, if I can get your information and we can talk offline.
Very good. Let's plan on doing that, Tracy.
Okay, thank you.
Mhm.
If we don't have
Hi.
any. Go
Yeah,
ahead.
this is Pancel. I have a question. So you mentioned, and I actually found the report, the health and all policies. Let me put myself on camera here. The health and all policies. So I was looking at it. So can you give me a brief synopsis as to, I know there's some things sort of kind of moving around health and all policies, but I was just wondering, what's the framework? And is there a committee working on that, or because I know I've done some research on health and all policies and where they were implemented in California and a few other places. So I was just wondering, what is it looking like for Michigan? Or if there's a
Um,
work for it.
okay, thank you for that question. Elizabeth, you want to answer that?
Sure. I'm happy to start the response, and feel free to jump in, Tracy or Tawana.
Okay.
Before we segue over to the health and all policies, I did want to mention, Joyce, that one of our colleagues, Janae Moore, on the food security work group, has been leading a great grocer program. So has been working, I think, focused more in Detroit, but was potentially a good person to connect with too. So I'm just saying that out loud. So hopefully we can both remember, Tracy, to include Janae in this conversation. She's been working with lots of grocery stores and markets and business owners, and it sounds like that might be a good connection as well.
Got it.
And awesome. Thanks, Samantha, for bringing in Muskegon too. Maybe we end up having like a small group discussion with Janae, if that's possible. That could be really exciting. So in our world, the policy and planning world, when we're talking about the social determinants of health framework, we tend to use it almost as a health and all policies approach. So the idea that we are trying to reach outside of the health department to the transportation department for reasons that you were just describing, Joyce. If the bus stop is not in front of the grocery store, that is a problem. We're thinking about the agricultural team, Michigan Department of Education. So trying to make those connections so that anytime a policy or program is being initiated, we're thinking about the health and ultimately the health and equity impacts of making this policy decision, of putting this program in place. So when Tracy was talking through the plans for phase 3 and the health and all policies, multi-sectoral initiatives is another way to say we're continuing the social determinants of health work with an emphasis, in our case, on food security and housing, and thinking about how we can move beyond the healthcare system to really draw folks into the conversation. So there are lots of ways that we can think about bringing health to the policymaking process, but in our case, we're focusing on that kind of cross-sector relationship building. That's also a part of the SDOH hub pilot that Tracy mentioned and is here on the slide as well, and Tawana and I have been working on. Just thinking through how can we make connections between healthcare and social care? How can we make sure that health considerations are always at the table? So for us, a long way to say that when we're thinking about the social determinants of health strategy, that's very close to and almost synonymous with the health and all policy framework or approach. Does that make sense, or anything else you would add?
It does. I think the next level question around that is there a move to adopt it as a framework at the state level, meaning it's embedded into legislation? So I was just wondering so that way anything that's being moved, whether it be for food, transportation, housing, that's the first lens that is checked and balanced through. That's what I was looking for. I know I heard some things, but I wasn't sure if it was like a full-blown, like, adopted framework at the decision-making level.
Not yet. And at our summit in January, there'll be more information about phase 3 and like documented strategies and intent behind those 3 community-driven solutions. So that'll be released in January at the summit. But I think you do, elevate a great point that with legislation, there's usually some type of resource or investment tied to that helps us do some more health equity work in the local community. So we'll definitely take that feedback to the committee that's documenting and writing out the phase 3 of the strategy to be released in January, and just making sure that we have some initiatives that are connected to policy and advocacy at the legislature level. Thank you.
It makes it a lot easier to organize when there's something there for us to push for. Thank you. Thank you so much.
Yeah, no, that's it.
Okay, Elizabeth, so you got it from here.
Yes, awesome. Okay. Well, I'm so glad you brought that up, Hansela. I think that's such a great dream that we share. So as Tracy was mentioning, we have 4 focus areas for the food security work. So this would be, just to kind of recap, activities that would be starting or continuing starting in January for phase 3 of the SDOH strategy. We are building on, as Tracy said, phases 1 and phase 2. So some of it's about expanding the work that's already happening, maybe taking a more focused approach. And then we also got some really great pilot ideas that folks have come up with, how can we try out some new things, try some innovative strategies. So these are the 4 general buckets, really thinking about how do we reduce disparities, really address inequities, how do we improve food access, how do we address negative environmental health factors, particularly the built environment? So as transportation has come up a lot in our conversations. And then how do we think about supporting agricultural development? As Tracy shared, we do have a pretty long list. So we've got, 30 ideas or so on kind of our main spreadsheet. We thought today maybe we could just show you an example initiative in each of the 4 areas, just to kind of give you a sense of what folks have been sharing and talking about. And then we'd love to hear your ideas or work that you're interested in doing, or you'd like to just have us make sure we kind of try to incorporate into the phase 3 strategy as well. And I saw that you unmuted, Joyce, so I don't know if you wanted to jump in or if you just want to be unmuted. That's either way is fine. Okay. So the first one is thinking about addressing environmental factors. And our director, Nina, flagged the Food Security Council report and their recommendation around establishing a Michigan Coordinating Council on access and mobility. And so this report was released in 2022, and it really offers a great framework for thinking about how we could get into that health and health policy space, really bring folks together at a cross-sector table and think about increasing access to grocery stores, making sure we've got the right kind of transit set up for folks to get where they need to go. So we are actually elevating their recommendation in our phase 3 strategy and thinking about how we could move that forward. Again, the council's given us a great start, and we're really hoping to kind of pick that up and continue that work. We've had some good conversations with the Michigan Department of Transportation teams, and they're actually thinking about a framework that's very similar to the social determinants of health. They call it access to essential destinations. So they're thinking about access to jobs, thinking about access to food sources, as well as access to healthcare and education. And so that's been helpful just to start to make those connections. I think we all are wanting the same things in many respects, healthy, thriving communities, but we don't always speak the same language. So just making those touch points and thinking about how we could work together to really address some of these transportation challenges. Anything else you want to throw in about transportation, Tracy? I know this came up with our community partners, both in rural and urban areas, and then we've been hearing about it from kind of the state stakeholders as well.
No, you could just talk about our meeting with John with MDOT and the work that we're doing with them.
Mm-hmm. Yeah, and so John's team is the team that's thinking about access to essential destinations, and then they're also thinking kind of longer term about, corridor plans. What does it look like when you've got, intersections with 8 lanes and folks are trying to get across the street to a healthcare clinic or to a grocery store? How do we really make that safer and easier for people to navigate? So it's opened up a whole new world, but it's been a great start to some of these conversations. And so when we're thinking about improving food access, we've got a lot of different programs that folks have brought to the table, thinking about how we can expand things that we already know work. So really building on best practices, and then also kind of trying out some new ideas. This is an example around expanding the Senior Fresh project. So they're really focused on reaching older adults. This was part of our phase 1 work as well, and they're continuing to really try to reach as many people as they can. So just kind of a quick example there. Reducing disparities and really addressing inequities is a big part, of course, the overall SDOH work. We've got a few pilot initiatives that we're really calling out in phase 3. So some interesting partnerships with Child Protective Services around food security, some interesting partnerships with county jails, actually trying to get folks enrolled in SNAP before they return to communities. And we thought we'd lift up an example that was part of phase 1, that they're continuing to expand the WIC team. Really launched a client advisory council. So it's been, I want to say about 10 WIC members, former clients and current clients who are really offering feedback on the program and really starting to guide the way that WIC reaches out to people, you know, how they can improve the WIC shopping experience. And so this has just been a really inspiring way to take community engagement to kind of that next level where community members are designing and really thinking about the programs and policies themselves. So we're excited that the WIC team is continuing to do that work, and we're hoping to learn from them and continue to replicate that. And then our last group here is thinking about supporting agricultural development. So we have been talking a little bit with the Michigan Department of Agriculture and Rural Development, MDARD, and they've got some great programs that they'll continue to do. They're thinking about a new funding opportunity that'll be coming out, we're hoping, in 2024. The example we're lifting up here is around the food prescription program. That's a pilot project with our Medicaid team, Grace Health Network, and then an evaluation team from Michigan State University. And so really thinking about how they can integrate kind of a food prescription process at a clinic. Folks actually get that prescription and can get it filled at local grocery stores or farmers markets, and just bringing those systems together a bit more. So we're excited about that program, and we'll hope to learn a lot from them and maybe connect that to a couple of other pilots. That is a great question, Grace Health Network. It may be in Ingham County, but I will Google that when I stop sharing my screen.
Grace Health is Battle Creek area, so Calhoun County.
Thank you.
Yep.
And then I think, before we say thank you, we are hoping to hear from you all and any projects that you're kind of thinking about or areas of interest, or any feedback you might even have on the main 4 focus areas. We're hoping this is the start of many, conversations with you all, and we can continue to work together and learn together.
Are we asking questions right now?
Yeah.
Yes, we.
Oh.
Sorry.
Go ahead,
Elizabeth. It's okay. Go ahead.
Oh, I don't know where this would go. Can you go back to the slide with the circles with the yeah. So I was just looking at these are the priority areas. So when we talk about, I don't know where this would go. I feel like when we're talking about disparities, there's food, there's transportation, but there's also the ability to this is utilities, like how what especially when it comes to alternative in terms of utility, like how do we I think that's a big piece, because people are struggling with just paying utilities because they're going up so high, and I feel like that should be somehow be part of the conversation. So
yeah, that's a great point. And I think, when we're thinking about social determinants and I hope that video doesn't play. When we're thinking about the neighborhood and built environment, or
yeah, that's it. There it is, right there. Yeah.
Just those basic needs.
Yeah, I was going to say, when you think about the social determinants of health, when we talk about housing, we talk about housing stability, as we spoke on that. Utilities will fall up under there, because you can't have stable home if you don't have lights and gas.
And you can't, and your children are taken away when you don't have lights and gas.
Right.
I mean, there's so many factors.
It's like a domino effect, because you can't have food if you don't have electricity, because you can't put them in a refrigerator. So it's a domino effect. So all of that plays a big part in social determinants of health. So those are partnerships that we definitely have to build, like with DTE, with
Mhm.
DTE and what is that organization that helps pay your utility bills?
Bills, pay utility bills. Oh, thaw. Yes, that's it. Thaw. Yes,
Yeah,
that's right. Yeah.
those are kind of people that we need to be connecting with, trying to build a relationship.
Mhm. Yeah. Well, and I think it brings up your earlier point too, Pansela, about the need to have a health and all policy approach. Everything is so interconnected. Just as you were saying, Tracy, you can't just pull food security out of this conversation or just pull housing out. And so how are we kind of holding the big picture while we're still trying to move forward individual programs or individual initiatives, and always keeping that big picture in mind? We don't experience our life with like separate social determinants. We are walking in the neighborhood and trying to go to the grocery store and pick up our kids from school and all that stuff at the same time. And so interconnection, interdependence is such a big part of this. And again, just bringing us back to your earlier point about having that health and all policies kind of way of being is so essential.
Thank you.
Are there any other food strategies aside from the food club that folks are working on or interested in, or just want to kind of make sure that we are keeping in mind?
I have um I had a conversation, and I agree with this. And a few people on this call, I think, agree with this as well. When we talk about health and food, how are there more, because I heard hubs, how are there more, and I'm interested in this too, in terms of um getting residents, people to understand the connection of food and health, and how I feel like there's a lot of heavy, if you in Detroit, the most beautiful buildings that are in Detroit are dialysis centers, which is really, it just irks me every time I drive past one. But in terms of, like when Joyce mentioned, there's no grocery stores, but you got dialysis centers everywhere. There's just got to be some kind of narrative shift, number one. And number two, getting people to really make that direct connection between food and health. Just really be very intentional. I know there's a few people here share that that thought very, very heavily, to understand that, and then and know how to, we talk about this too, to advocate for themselves at the doctor's office, that they don't, this is because it's a doctor, but that doesn't mean that they're the authority over your body. So how do we have that kind of education around social determinants of health? How do people make those connections? We lean heavily, and I'm not trying to say that people shouldn't lean heavily on the doctor. I think medicine has its role, but I also think there's a counterproduction in terms of access in health. So
That's a good question. I don't know if you saw the news. I don't know if you live in the Detroit area or not, but if you saw you do. Okay.
I do. Yes, I do.
Okay. So did you see the story that NBC just did on a young African American guy? He just opened up a grocery store in Detroit to combat
the food co-op.
No. He just opened up a grocery store on down by Gratiot area to combat food desert in the city of Detroit.
Yeah.
His goal is to partner with local farmers to bring fresh fruit and vegetables. So he just had his grand opening on Sunday.
Oh, nice. Okay, I didn't see that.
The city gave him a $75,000 city match grant.
Mm-hmm.
So
nice.
I think so. It is efforts out there. We just got to get people to know it. Yeah. And also, like the food is medicine program. I know like Trinity Hospital, with their client, I believe it's Trinity, where they get a prescription and they can go get fresh fruits and vegetables. I don't know what other hospitals or clinics that's participating in that, but I do believe Trinity is.
Yeah. So I think it's making the direct connection to these services as well as community education. So training community to talk to other community members about all these kinds of resources too.
Yeah.
Thank you so much, Tracy.
Thank you.
I think that brings up a great point that might link over to some ideas for the SDOH hub pilot. And just hearing you say, connecting with community, we're thinking about how we can incorporate community health workers kind of more broadly in different spaces and in different programs, and thinking about we're wanting to advance policy change and holding also kind of space for programming and education and connection, and having that peer-to-peer learning opportunity, and having community health workers really growing that workforce too. So that is part of kind of the hub pilot framework, thinking about these, health and health policy approach kind of initiatives, community health workers, and then also thinking about that community information exchange, making those connections between healthcare and social care. So just wanting to throw that out there too. I think that's such a great point.
And also, I'm sorry. Go ahead.
No, is there a committee for health and all policies? Is there like an open advisory or something? I would like to infiltrate.
There is not a committee, but we can take that you're interested in participating.
Okay.
To our team and see if there's a way or a space, and how can we make a space available.
Okay, thank you.
Thank you.
Well, Portia, I was all gonna say too, you might be interested in this too. We have a new initiative, the Community Influencer Program. And so the Community Influencer Program, where we have community members to go out in the community. They are voices in the community to tell us the gaps of services and what we're missing, and they bring back the information to us, what's needed in the community. And we just started that program. It's a Community Influencer Program. So hopefully that'd be a way to connect us with the community, because they will be our voice in the community, and we have representation in all the prosperity regions around the state.
How do you, this is Joyce again, how do you get connected to this community influencing program? Because I know that Detroit probably has a lot of people in that area, but do you have them, as you say, all over the state?
Yes, actually, we just finished up our orientation. So we did have quite a few representation from the Detroit region. They all attended the orientation. So we do have a few. We have another class orientation will be starting in June, but I can definitely send you information on the Community Influencer Program. I have your email address now.
Okay, please.
I can send you information on that.
I just wanted to highlight some of the things that were mentioned in the chat. So Oakland County Health Division has a prescription for health program that is funded through the USDA's GUS NIP. And then I know, I asked you all a little bit earlier, but have you been able to confirm if we'll be able to share the slides? There are a few folks interested in, just being able to see anything that they might have missed. And I think that's everything.
Yes, yeah, we're able to share the slides.
Awesome. Thank you.
Joyce, there's a whole community influencer guidebook. I love guidebooks. Did you see it?
No, but I'm going to look it up for sure. I'm writing myself some notes now. All right. All right, chance. This food issue is a big one in our community. Our city government actually put out an RFP with ARPA funds to say, can someone help us to address this problem? And we'll take proposals and give me ARPA funds. Only one group responded, that's the food club, and they gave them $1 million. And as I said, they've been able to raise another 3.5 million, but it's going to be targeted to Alice people. So as we look at the overall issue of food issues and not being able to get to grocery stores, that is not going to help, a good portion of the population. I think we got to address the concerns for the Alice population. This is a big concern. I'm just glad to see in Detroit that they have someone who stepped up to the plate to try to do something. I've written that down as well to look that up and see how they've gotten started, because we have to have some ideas about how to do that. Because I think our food club strategy is something that needs some more thought. Unfortunately, they didn't have anybody who looked like me or other diverse groups on that group that put that together. And as we told them, we think that's a problem, because the issue, will the Alice population even use the services, since they have to pay a fee every month, $11 to $16, even though they get the food free? Will they use the services? And if without approaching those groups, you will not know whether or not you're going to be effective or not. So that's why I said I want to help her. We don't want her to fail, but we also want it to work. We wanted to make sure it's going to be, really manageable. Well, whatever the case is, this is some exciting discussions. Your presentation was really great. I would love to go in really more detail into some of the charts that you showed me. And I know that we don't have enough time to do that today, because I think I would have many, many questions for some of the, with needed more breakdown and just more information on how you're moving forward to try to implement these strategies, and who's at the table, who's involved in it, what areas of the state are you working in, or maybe having an impact. Just those are the kind of questions that I have. So,
well, Joyce, we can definitely chat offline, and we can do a one-on-one with you, and we can answer any questions that you may have.
Hey, Tracy, that would be great, because I think I've got a good half hour worth of
Okay,
conversation with you, so that I can just ask these bunch of questions. And if you're going to send out that your PowerPoint, that will help me direct some of that conversation I want to have, if I could get that, please.
Definitely, and we can set up a one-on-one with you for 30 minutes. So
that'll be great. That'll be great.
Okay.
I just wanted to give folks space, for maybe one more last comment or question that they want to share, so that we can, if there are other questions that folks brought, give a little bit of, space for that. So.
One thing, Danielle, she knows that in Saginaw, we did 11 focus groups. So we really tried to cover our community in every segment we could get our hands in and get involved in. But anyway, we got those today. Just before I just came read the 81-page report. And I am telling you, there is so much commentary in there where we have literally quoted verbatim what people have said about some of these critical issues, especially as it relates to not having access to quality food, and all of the issues surrounding that. So as you talked about including some storytelling, I would love to share some of those documents with you, so you can see exactly what people said. Some powerful stuff in this reading that I have here. So be happy to share that.
That would be great. Thank you so much, Joyce.
Mm-hmm.
Well, I just want to say, thank you so much to Elizabeth, Tracy, and Tawana for coming today and sharing a bit about the work that you all do. When I first learned more about what y'all were doing, I have a deep passion in food security. So this really brought me joy to bring this work together. And allows some space for all of us to share. So I just want to say thank you so much. I'll be sure to email the links that are in the chat out, as well as the slides, to everyone. If there's other information that your team would like for us to highlight in the wrap-up email that I send, just feel free to let me know, and I'll make sure to include that. And then, whatever else kind of comes from this, it sounds like a lot of people will be engaging with the community influencer program, kind of talking with y'all one-on-one. So I think there will be lots of opportunities for crosswork, and that is super exciting.
Thank you so much for having us, Danielle.
Yeah, no problem. I will still be here for the remaining 8 minutes if there's other questions. I know, Pansol, I saw you raise your hand. It's all good. That's the point. So I'm still here. I just wanted to leave space for folks that had questions about contracts, activities, what have you. And that's about it. Go ahead, Pansol.
No, I wanted to, I guess, I know we owe a lot of stuff. So, invoicing, but also our update on our work plan. I just want to let you know, we're still trying to coalesce that. So I just want you to know we haven't forgotten. We're just still trying. I know we were trying to get it done in September, but give us a little bit more time to finesse through that some more.
Yeah, I know some folks shared action plans that were a bit of a draft, and then they had to meet again with their councils because they were either doing strategic planning or aligning their work with their CNA or their CHIP process. So I know that there are at least a few others who may be revising theirs. So
Okay.
I understand.
Okay, I just wanted to let you know.
Yeah.
I wonder if anybody else have any questions. From my team, I mean. I see Chandra's on and Andrea's on.
Yeah.
No questions, just a great presentation. I had a meeting that the time was, I thought East Coast, but it was West Coast. So I thought it was in the morning. It ended up bumping up with the beginning of this. So it seems like this was one of the best ones. And so I look forward to getting the slides from the portion that I missed. But again, great session.
Yeah, thank you so much for coming. As always, those are going to be recorded, and we'll share the recording with everyone, as well as the slides. And then we'll have the contact information for the folks that presented today as well.
Perfect.
Thanks, Andrea. Any folks from Muskegon or Ingham or Ottawa have any questions, comments, rants, thoughts?
Danielle, I think I just got like information overload because we're doing CIE work, we're doing food desert talks, we're doing community listening sessions. I'm a community health worker with 10 years experience.
Nice.
So Sam just sent me the listening sessions. I'm sorry, my brain is dying.
That's all right. I know y'all are also doing your neighborhood. How could I've just totally blanked out the name of it. Sam, you know what I'm talking about.
Livability Lab.
Yes, Livability Lab.
What is it called? I'm sorry, what is it called?
It's Livability Lab. It's really cool. I'll drop the link to it in the chat. It's a really cool community engagement, really empowering community action.
Yeah, one of my health equity council members joined a team, so I'm doing like 15 things right now. But I'm going to be participating. Sam allowed me to participate with the CIE talks, with me having a background being a CHW and working for the hospital system. I did a lot of social services, direct services back then. So that's been really interesting. And we've been doing economic opportunity initiatives with like community meeting spaces for residents. So they're killing it. And I'm just trying to keep up.
I want to connect with you on the Livability Lab. I want to know more. This looks pretty good.
It's a really fun event. We're just finishing up our 4th year, so we're just getting into the action teams. And one of my Health Equity Council members, Myrna Olsen, who is our Filipino representation, joined the team to do her cultural exhibit that we've been planning. She applied for a mini grant. So we're braiding, funding, I don't know the word, the terminology for it, but aligning and collaborating and all the good stuff.
Nice, nice. I have to say, I don't know if there's any men on this call. I just think when we just get stuff done. We just work. So don't ever apologize for, we just get in there and do it. So it's a two-edged sword, but you know, we do it.
I always love the positivity you bring to all of our meetings, Marcella, so thank you.
I stay positive.
Yeah, I love it.
So Samantha, this is Gloria over in Ottawa County, and I just pulled up your livability lab. That sounds really fascinating. I may have to pay you a visit if I get a minute.
Mm-hmm. I think we need to have them on the next call, like this call, where they can just lay
for the
out the
next office
livability
hours?
lab.
Right.
Lay out the full layout, the livability lab. So I think this is pretty good.
Yeah, because I'm, we're restarting, and as we go through, it's like, okay, are there other items that we need to be aware of that can really help with our populations? And this, I think, would give a lot of great ideas. So, and I don't have my video on because my connection is a bit weird today.
I'm in the same spot with the connection, so I'm glad to be in good company. But I will say we are always happy to share about Livability Lab. Every year that we do it, we just become even that much more excited about it. We have learned so much within our work from other communities, and we're always, happy to give back and share, some of the exciting things that we really see working locally. And a shout out to Shoni, obviously, who you guys know and is a rock star and brings it all together and aligns all of those pieces so well. As well as Marquise, who's on the call here, who I know you guys have met, and he does incredible work as well. He's been with the lab since the very beginning, since, really even coming up with the approach of creating it. So anything, we're happy to share. Great resources right here.
Thank you. Okay, I have to pop off for another meeting. Okay.
That's all right.
Bye. Thank you, everybody.
Thanks, everyone.